The mask mandates and social distancing rules in place, those are pretty much ways we're going to have to operate moving forward with COVID-19. But there's some research that suggests that even simple breathing techniques may help better protect us against COVID-19. So here to talk a little bit more about that with us this midday is Dr. Ignarro. He is a Nobel Prize-winning pharmacologist and former UCLA professor. Thanks for being here.
Great to be here, Terry. Thank you.
Can you explain these breathing techniques, how they work and how they might better protect us?
First, let me just tell you something about nitric oxide, which is a molecule that we discovered about 25 years ago or so. And nitric oxide should not be confused with nitrous oxide, which is laughing gas. It's something you get in the dentist's office, for example. Nitric oxide is completely different. And what we discovered was that our bodies produce nitric oxide for the purpose of improving blood flow throughout the body. Each one of your blood vessels, and believe it or not, we have 100,000 miles of arteries and capillaries in our body. Every one of those blood vessels produces nitric oxide to improve blood flow, to lower the pressure, and to increase oxygenation of the blood in the lungs. So those are the main actions of nitric oxide.
How should we be breathing, especially when we're wearing these masks?
About 15 years ago, some Swedish scientists discovered that our nose, the nasal cavity, actually produces a large amount of nitric oxide, and that travels right into the nasal passages, so that when you breathe in through the nose, you are taking in the nitric oxide into your lungs. And this is a very good thing because nitric oxide improves the circulation, as I said, in the lungs, gets more blood in the lungs, but nitric oxide also relaxes the airways, the trachea and the bronchioles, to get more air in your lungs. So if you get more air in the lungs, you get more oxygen, right? And therefore you're going to get more oxygenation of the blood because you have more blood flow. So those are two important effects. The other important effect is that other scientists found that nitric oxide can kill or inhibit the growth of many different microorganisms, including viral particles. So nitric oxide is, if you can get it into the lungs, will go a long way in healing your lungs and maybe even preventing the development of this COVID-19 that we see. That's the hope, of course.
Is it really just as simple as breathing that could help us prevent some of this?
I think so. I'm a scientist, so and many of us scientists think this way. Let me explain that there's a commercial product. It's been available for 20 years now. It's inhaled nitric oxide. It's given only in the clinics because it comes in cylinders or tanks containing nitric oxide. And this is the nitric oxide is given by inhalation to people, mainly infants. Many newborns are born with high blood pressure in the lungs. And as soon as they're born, they turn blue. And if something is not done about that, most of them pass away. But when they're given inhaled nitric oxide by inhalation, within minutes, you can see the blue babies turn pink because that nitric oxide has improved the blood flow and oxygenation of the blood. And after a couple of days, those babies can go home and they're cured. Also, the SARS outbreak, remember in 2003, 2004, some physicians tested inhaled nitric oxide in those patients, and it worked. It actually cured the patients of that particular lung infection from the SARS-CoV, and scientists determined that nitric oxide can kill that virus. So since the genome is very, very similar between the SARS-CoV back then and the one we have now, the SARS-CoV-2, we have every reason to believe that the nitric oxide will be effective. And there are clinical trials now going on in 5 different institutions, including Texas, and hopefully in a couple of months, we'll know the results of that clinical study.
Dr. Ignarro, we appreciate you joining us. Thanks so much.
It's a pleasure, Terry. Thank you, and have a great day. Be safe.
If you'd like to see this full interview, you can catch it on KVUE.com.